and good morning. It's Friday, and that means it is time for our Lunch and Learn with me, Dr. Polly Heil-Mealey at Abundant Health and Wellness. Now, trying to do a sound check, trying to see if I'm right way up, if you can hear me. We can hear me. Okay, good. Okay, and I'm right way up. Okay, that's what we need to see, so thank you for that. So, what we're going to talk about today is the circadian rhythm sleep cycle. Okay, so what this means, it is a cycle of sleep, or it is a cycle of repair that the body goes through when we are sleeping. So there are some sleep disorders. We get a lot of calls into the clinic of, I can't sleep, can you help me sleep, and that kind of thing. And certainly we want to do that. And so want to just talk about that for a little bit, because people have issues. Now, if you are a postmenopausal woman, you could be having issues just because your hormones are out of balance. If you're a youngster, a teenager, or a young adult, you could be having sleep disorders because you're on your devices too long. Blue light disrupts your sleep cycle, and so we want to make sure that that's not happening for you. So a lot of times we'll ask you to get off of your devices, or turn off your TV and turn off the iPad and that kind of thing, an hour to an hour and a half before you go to bed if you're having sleep issues. So you can Google circadian sleep and follow along with me. We'll be posting some things after the video ends, and so we'll see kind of where we are. But want to talk to you. We've got a little graphic here that we're going to post. And this says circadian rhythm sleep disorder. So these are some names. What it means is that your sleep-wake cycle is off. Now, when we have babies and the babies wake up in the night and they're up all night and they sleep in the morning, we say that they are off of their regimen, their regime. We say that they've got their days and nights mixed up. Now, sometimes that happens to us older people as well. So, CRSD, circadian rhythm sleep disorders, okay? They are physiological. That means it's not in your head. It has to do with what is going on in the body. So, faulty rhythms of melatonin, cortisol, and your core body temperature. Now, cortisol is a hormone that your adrenal glands make as a response to a stress issue. Hey, Ronalda, thanks for joining. I appreciate that. So if you have a lot of stress in your life, you're going to have what we talked about this last week, the pregnenolone steal, where the pregnenolone is going to make cortisol instead of going to make some of your other hormones. And what we want to do is make sure that that's not happening. So there is the delayed sleep-wake phase disorder. These are people who go to sleep very late and they wake up very late. And so this is something that your body clock is just not synced. This affects 1 in every 600 adults. Okay, so that's a lot of people. There is the non-24. You've seen this talked about on television when they're talking about blind people. They've got the non-24 sleep-wake disorder, and their biological clock just tells them that their day is actually 24 hours, which we know that is your calendar day, but you're supposed to sleep in the evening. Now, back in the day, before we had electricity, people would go to bed with the chickens. When God turned out the sun and the moon came up, it was too dark to do anything, and so people would go to sleep and they wouldn't wake up until the sun came up. Now that the Industrial Revolution has come along, we all have light bulbs and all that good electricity, which I'm so very, very thankful for. But because we have that, we're not so good at keeping with the rhythms of the body. So this is what you need to know when you're not sleeping properly. Now, what we want you to do is we want you to start going to bed around 9:30, 10 o'clock. We want you to do that because the body has a specific cycle that it works on. And we're going to post some things so you know if you don't write everything down. So just so you know, at 10 o'clock, the body starts balancing itself and starts getting sleepy. It wants to start repairing the endocrine system. Now, your endocrine system is all of your glands, anything that makes a hormone, right? So that would be your hypothalamus, your pituitary, your pineal, your thyroid, your adrenals, your pancreas, your ovaries, testicles, whatever glands you have, the body starts getting those to sync up so that everything can make the right hormone. So that's at 10 o'clock. At 11 o'clock to 12 o'clock, when you're sleeping, your body is doing some cellular repair. It's particularly working on your gallbladder. It's working on your red blood cells. It's building your red blood cells. When you are at 1 to 2 p.m., your body is working on your liver. It's detoxifying the liver. So if you wake up between 1 and 3 p.m., what your body is telling you is that you have what we call reactive hypoglycemia, right? Reactive hypoglycemia. Your liver is saying, hey, I need to detoxify. I need to go through the phase 1, phase 2, phase 3 detoxification pathways, and I don't have enough fuel to do that. I don't have enough nutrients to do that. So when you wake up during that timetable, your body is telling you that or your liver is asking you, please go down to the refrigerator and get something to eat so I have enough nutrients that I can finish my work. So if that's something that happens to you in those hours, then that's what your liver is trying to tell you. So we've got a really good product here at the clinic called Hepatogest, and it is a powder that is full of nutrients for your liver. We ask you to put it in a smoothie after dinner so that your liver has enough nutrition so it doesn't wake you up in the wee hours of the morning. So if you wake up between 3, 4, and 5 o'clock, this is where you should have your deepest sleep, and this is where you will have most of your dreams. This is where your memory is cleansing itself, and this also is where your lungs are detoxifying. So if you wake up coughing, that is a good sign because your lungs are detoxifying. Now this could be because you're a smoker, but you don't even have to be a smoker, especially here in the Houston area where we've had the Hurricane Harvey back in September, right? August, the Heil-Mealey, thanks for joining, with the mold and all of that's in the atmosphere. When you could find that you're waking up and you're coughing and that kind of thing. So that is just the lungs detoxifying. So that's a good thing. So if you find yourself waking up, as most of us do, between 5, 6, and 7 in the morning, this is the time when the large intestine is doing what it needs to do. And so the bowels will usually release at this time. Most people get up and do what they need to do, and they will have a bowel movement, and they call it their daily constitutional and all that kind of stuff. Well, that's because that is the circadian rhythm of the body so that the body can do what it needs to do. So these are the organs that cleanse themselves and detoxify themselves in the middle of the night, and this is why you need to be sleeping. So, sleep, and you might think that, oh, well, I was up late last night, but the night before I got 8 hours, and tomorrow night I'm going to get 8 hours and all that. Well, sleep deprivation is cumulative. That means you don't recover the next night that you sleep a long time, or the next day that you stay in bed for a long time. So what you need to know is that your body, if you sleep later the next day, you'll regain maybe a quarter of the sleep that you lost the night before, even if you were in bed. So the longer of the time that you've had without sleep, the longer time you're going to have staying in bed, being restful in order to make up that deficit. So let's talk about what sleep deprivation does to your body. So mental health. If you are sleep deprived, then you will have stress, anxiety, depression, neuroticism, Okay, that's a big word for just mental illness. Reduced vigilance, that means you've got brain fog and that kind of thing. And then you also could have burnout syndrome. You also could have cardiovascular events. So when you are sleep deprived, chronically sleep deprived, you are at 40% greater increase of cardiovascular events. So when we're talking about sleep deprived, I'm not talking about going to bed at 3 a.m. and getting up at 11 a.m. That's not what I'm talking about. I'm talking about if you're not going to bed regular nighttime time where your body can repair itself, then you're going to miss those repair cycles and you're going to have some problems with this. So we want to, if you are at any risk at all on the cardiovascular side, you really, really need to make sure that you're sleeping appropriately, because sleep deprivation makes you 40% more liable to have a cardiovascular event. If you are sleep deprived, you are going to have a hard time carrying a pregnancy full term, right? You can have a low weight pregnancy, or you could even deliver prematurely. So it's very, very important that if you're pregnant that you go to bed early and sleep at the appropriate times, because you're not just sleeping for one, you're sleeping for two, okay? So if you're circadian rhythm disruption, you would have a change in your body temperature. So if you wake up hot in the middle of the night, if you wake up cold in the middle of the night, that disturbs your sleep. Also disrupts your respiratory rate, also disrupts your hormone production, also can disrupt your menstrual cycle if you're a woman, and it also increases your urinary output. So if you are waking up in the night, getting up to go potty multiple times, if you're a man, we're going to suspect that you have prostate issues. If you are a woman, we're going to suspect that you have adrenal issues. And adrenal issues are when you are in that fight or flight cycle, and your stress hormones are just going all the time. It's going to activate your kidneys, because you're not going to be making your antidiuretic hormone. Now, I know that's a lot of fancy words that you may or may not get, but what that means is you're just going to get up and potty all the time, so we don't want that. When you are not sleeping the appropriate amount of time, then you will have fatigue, and it will actually make your brain shrink. So none of us have time for that, right? And so we want to make sure that your brain is functioning at optimal level, and you're able to not have the brain fog, and you have mental clarity. So if you're having sleep issues, then that's something to think about. Now, your gastrointestinal system, right? You will have, if you are sleep deprived, you will have more cases of upset stomach. You're going to have more cases of heartburn. You're going to have more cases of abdominal pain, and you're going to have more gas and bloating. So if those are some symptoms that you deal with, then you might want to check and see what your sleep cycle is doing, okay? Because nobody has time for GI disorders. And of course, we have different protocols here in the clinic to help you with that, to rebuild your biological terrain so that you're able to get what you need. Now, when we are working on the GI tract, and we're replenishing and replacing those kind of things. Hey, Aunt Jerry, thanks for joining us. When we are doing those kind of things, the people usually respond that when they have been on these protocols for even as long as 2 weeks, and this particular protocol takes about 6 weeks, maybe 8 weeks. And when they are doing this, they report in that I have more energy, that I don't have as much bloating, I don't have as much gas, I'm sleeping better, and I'm losing weight. So when we have this gastrointestinal disruption, it's going to disrupt your sleep. And then when you have this disrupted sleep, then you have all these other issues. So we don't want that. There also is an increased incidence of breast cancer and colorectal cancer when you are not sleeping the appropriate time. So again, nobody has time for that, right? So what can you do to arrest your sleep cycle? Well, you can do a lot of things. We have here at the clinic, we've got a lot of different things here. We've got, this is a little tablet that you, let's see, how many do you do? Let me see, what does it say? It doesn't say. Directions. Okay, 2 to 3 tablets under the tongue before sleep. This is homeopathic, it's not habit forming, and it's something that could help you. We've got people that come in all the time to get this product because it's very, very good. It's homeopathic and we like it. A lot of people will supplement with melatonin. Now, I'm not a fan of melatonin because melatonin is at the bottom of the neurotransmitter food chain. Okay, and what that means is in your brain, you've got your GABA, which is at the top of the food chain, and then you've got your epinephrine, your norepinephrine, your serotonin, your dopamine, and then at the very bottom of the food chain, you've got your melatonin. So if you are supplementing with melatonin, but not getting everything else in the food chain lined up, then you're not going to address your sleeping problem, right? So melatonin, you only want to be doing a 3 milligram melatonin, and you don't want to do it for more than 3 nights on a consecutive basis. Now, I know that's not what you've been told before. I know that's not what your package insert tells you, but I'm just telling you from a medical perspective, you don't want to do that. Now, they do have melatonin in the 10 milligram concentration, and that is usually by cancer patients. So excuse, my phone was ringing, 800 number. Don't call me when I'm doing Facebook Live. We don't like that. Okay. We also, this is what I prefer. This is called phenotropic, and it is a preformed GABA. The preformed GABA is at the top of the food chain in your brain in the neurotransmitter, and you can take 1 or 2 of these at night. We've had people that were addicted to Ambien and different things for sleep, and we've been able to substitute this, and they've been sleeping just fine. So this is a very, very popular thing that we have. It feeds the neurotransmitters at the top of your brain, and everything just trickles down, and so you get the melatonin that you need. Another thing that we have is our CBD oil, and I think we're sold out, and so we don't have any today, but we'll probably have some next week. But CBD oil is great for insomnia, and it there's no THC in it, so you don't have to be worried about a drug test and that kind of thing. But what it does is it just goes in and it rebalances your endocannabinoid system, which all of us have. So that's something that we have as well. 5-HTP, this is an amino acid, and it is the same component as tryptophan, and this is why when you eat turkey at Thanksgiving and Christmas that you get tired, is because you have tryptophan. And so this is really good for helping you sleep if you need that. And this is 2 sprays sublingually twice a day. And it has some other good things too. If you are a patient who is a cancer patient, or you are battling a chronic disease and you have no appetite, this actually will stimulate an appetite. Now, most of us don't need that. Most of us need weight loss clinic, which we do here in the clinic as well. But if you're one of those people that has problems and you're not able to eat, you don't have an appetite and that kind of thing, then the 5-HTP will help you. We've also got a herbal tincture, valerian. And valerian is a nervine herb, and it's very, very relaxing, and it also will help you sleep. So we've got quite a few things in here in the clinic that will help you sleep. It's not just about fulfilling your 8 hours in the bed, right? It is about making sure that your body will repair itself and it will get the rest that it needs. So in God's prescription, right? For health, one of the things that is very, very important is rest. Now remember, in creation, God rested on the seventh day, and we should be carving out times of rest. And a lot of people say, oh, well, that was Old Testament and I don't need to do that. Well, that's fine. You can think that. But the body works much, much better if it's not stressed all the time. And if you live in the city, if you are very busy and you've got a lot of things to do, then you're going to want to burn the candle at both ends, as they say, and you're going to be shortchanging yourself with your health needs. So we want you to be healthy. We want you to live a very long time and to be able to do all the things that you want to do, but you've got to have good nutrition. You've got to have good response to your food, so you've got to digest it, you've got to eliminate the trash, and you also have to have your neurotransmitters doing what they need to do. If all of that is not working properly, then you're going to have these sleep disorders. And so that's why we wanted to bring attention to this today, because a lot of people think that they do just fine on 3 to 4 hours worth of sleep. Really, you might think you are, but it's going to take a toll on you in the long term. So this is what we recommend and want to bring attention to this. If you are a shift worker, you're going to have some issues if you're sleeping through the day and working through the night. Now, normally a shift worker, you do graveyard some and then you do regular. So you want to make sure that if you are a graveyard shift worker, that you really take a lot of nutritional supplements for your endocrine system. Those we call glandulars. And remember, your endocrine system is your glands that make hormones. So we have here in the clinic all of the glandular supplements. Now, we don't recommend that you take them every day all year round. What we recommend is you do a glandular for 30 days and then you get off of it. We don't want you on a glandular for more than 30 days at a time. So these are our recommendations. I hope you've learned something. If you have any questions, then feel free to email us, and we will see you next week at noon on Friday. Have a great weekend.